name is Dr. Dylan Walters. I'm a health economist and project director of health economics at Nutrition International. It's my pleasure to speak to you today about the cost of inaction on maternal nutrition and the cost effectiveness of MMS. Nutrition International has developed a suite of analytical economic tools for nutrition policy and investment decision making. We developed the cost of not breastfeeding tool in partnership with Alive and Thrive a few years ago, as well as the MMS cost benefit tool. In 2024, we have just released the cost of inaction tool. The cost of inaction tool is an easy to use analytical tool that helps users estimate the health, human capital, and economic cost of not investing in nutrition for children under the age of 5 and women of reproductive age. The tool is designed to support advocacy, policy decisions, and investments linked to WHO targets for stunting, anemia, and low birth weight. The tool can generate estimates globally, regionally, and for over 140 countries. The tool can generate estimates on the caseload, mortality, number of IQ points lost, number of school years lost, and the estimated economic cost of stunting, low birth weight, anemia in children, and anemia in girls and women. Using the tool, we have found that the estimated total cost of undernutrition in Africa is at least $150 billion per year, which is equivalent to 5% of gross national income. Conversely, we have used the underlying economic model of the tool to estimate that at least $70 billion in economic benefits could be generated annually by reaching the WHO global nutrition targets by 2030 on stunting, low birth weight, and anemia in sub-Saharan Africa. In addition, the cost of not breastfeeding in Africa is associated with annual health and human capital costs, including diarrhea, childhood obesity, child mortality, and health system costs of over $680 million per year. We encourage you to visit our cost of inaction tools at www.nutritionintl.org/cost-inaction-tool or Google search for NI cost of inaction tool. On this site, you can see the interactive dashboard that can generate estimates at the national, regional, or global level, as well as see our journal article, our regional briefs, and get in touch for further technical support. Despite the findings on these significant costs of undernutrition from the cost of inaction tool and other evidence, the good news is that there exist many evidence-based, cost-effective nutrition interventions. This has been highlighted in other evidence before, but the new World Bank Investment Framework 2024, released several weeks ago, highlights numerous cost-effective interventions that can optimize outcomes within nutrition budgets. MMS for pregnant women, which you are speaking about in this workshop, is highlighted under the stunting and maternal anemia target frameworks for cost-effective interventions, and is one of the best interventions for optimizing limited nutrition budgets in development context. The NI-MMS cost benefit tool is available to you to help answer the question, is MMS better value for money than iron folic acid supplementation? As we know, the additional cost of MMS and budget impact was expressed as a barrier for many countries when implementing new MMS programs. We have developed this tool to support your decision-making and investments on maternal nutrition. The MMS cost-benefit tool can estimate the impact of MMS compared to IFAS for all significant health outcomes, as well as estimate the budget impact, cost effectiveness, and return on investment. As you may know, recent evidence suggests that MMS has additional health benefits compared to IFA, such as reduced risk of low birth weight, reduced risk of small for gestational age of births, reduced risk of preterm births, and reduced risk of stillbirth, and reduced risk of neonatal mortality in females, while having an equivalent effectiveness on reducing the risk of anemia during pregnancy. On our website, you can find many investment case briefs for key countries, including, as an example, the country of Nigeria here, where pilot projects of MMS are currently being tested. But based on our economic model for MMS, we estimate that a hypothetical scale-up of MMS coverage to 30% over 10 years could result in over 41,000 additional child deaths averted, or 2.8 million DALYs averted, and have a very high positive return on investment. Along these lines, the 2023 Copenhagen Consensus analyzed various nutrition interventions and found multiple micronutrient supplementation to be the best buy in the nutrition sector for helping achieve the Sustainable Development Goals. These previous analyses didn't even include what are new findings on the potential additional effects of MMS on reducing non-communicable diseases. As recent research by Harvard School of Public Health and NI found that scaling MMS may also help avert NCDs, which are associated with the double burden of malnutrition in the next generation. Again, as an example in Nigeria, this research found that scaling MMS coverage to only 50% could help result in 49,000 cases of hypertension averted annually, 19,000 cases of averted diabetes annually, and over 250 NCD deaths being delayed. Preventing this amount of non-communicable diseases would also lead to a reduction in future direct and indirect healthcare savings. Nutrition International has also been working in executing pilot projects related to MMS in several countries, including Pakistan and Nigeria. Along these pilot projects, we have been conducting cost analysis on the cost of transitioning from MMS, from IFA to MMS. We have developed a framework that allows us to monitor and capture the cost of transitioning from IFA to MMS. And these types of costs include incremental transportation costs, incremental training and awareness costs, incremental enabling environment costs, technical operational support costs, routine monitoring, and implementation research costs. It is important to try to capture these costs and factor them in your estimates for the cost of transitioning and scaling up MMS in your countries. We are finalizing the reports on these projects and hope to release findings in the near future. All of this data from our various analytical economic tools can be used strategically, and we've seen this being used in many countries already. These data from the economic analytical tools can be used to inform global and national policy dialogue and guideline development, such as the WHO antenatal care recommendations a few years ago. The data points from the cost of inaction tool can be used to empower civil society groups and the media with powerful data points for traditional or social media. These data points can also be used in the justification for new legislation that supports maternal nutrition, such as been done in the Philippines. These cost of inaction data points are also very powerful in strengthening investment cases by governments at the national and subnational level, and multilateral development banks or regional economic groups and philanthropic foundations. So in conclusion, our cost of inaction tool is available to use by any user now online and generates estimates on the health, human capital, and economic costs of not investing in nutrition. The tool finds that more than $70 billion in economic benefits can be generated each year by scaling nutrition interventions, including maternal nutrition programs that can help achieve the proposed WHA global nutrition targets. If further technical support is required, please feel free to reach out to me or Nutrition International on our website for the cost of inaction tools. Thank you very much for your time, and I wish you the best in your workshop this week. Thank you.